Welcome to the Kochavah Show. We are happy that you've joined us today. The Kochavah Show emphasizes health, science, education, and spirituality. We want to bring into your homes the very best guests to share great topics and information so that you can learn and share at your very best with others. So please check your program schedule for the times that we air. If you have internet, go to WTV10.org and check the program schedule. Send your inquiries and comments to kochavahshow@yahoo.com. Today we bring you part one of a four-part show on the topic, the significance of near-death experience, or NDE, also known as out-of-body experience, or OBE. Our return guest is here to share great insight on this controversial topic. What makes it controversial? Because it's individually subjective. Not only will he talk about it, but explain its significance. Dr. William Guy. Allow me to share his academic credentials. He received a PhD from Wayne State University in experimental pathology, doctoral minors in pharmacology and clinical biochemistry, received his medical degree from University of Michigan, trained at Beaumont Hospital in diagnostic radiology and nuclear medicine. Also residency in psychiatry and behavioral neurosciences. He is currently a practicing psychiatrist. We are very happy to have him here with us to give us insight on the topic so that we can intelligently share it with one another. Thank you for having the Kochavah Show in your presence. Hi, once again, this is the Kochavah Show, and I am your hostess, Kochavah Lathem. And as I mentioned to you before, we have our special guest that has returned, and we're very, very happy that he's here with us, and that is Dr. William Guy. We mentioned before that he would return and give us information on a different topic, and again, we're very pleased that he's here with us. Welcome again, Dr. Guy. Very happy to have you.
Thank you. It's my pleasure to be here.
We have a very, would be considered tough topic, some people would consider, and then it's very controversial, the topic, which is near-death experience, in other words called NDE, and we really wanted to go into some areas that, so that people can understand what that is more. It's been explored for many, many years and studied and researched, and we're just happy to have you here to enlighten us on the subject.
Well, I'm happy to do it. It's an important area. With regard to it being controversial, it's controversial because a lot of people are talking about it. Mm-hmm. A lot of people are talking about it because a lot of people are having them. Back in the 90s, there were at least 8 million reported cases in the United States alone. Clinically, about 1/3 of people who undergo cardiopulmonary arrest and are resuscitated, about 1/3 of them will report some type of near-death experience. Mm-hmm. That basically involves either being dead and coming out of their body and looking down on their own bodies and seeing people work on them, to popping out of their bodies and seeing dead relatives, angels, or God, mm-hmm. Going into the tunnel, and so forth. We'll talk about more of that as we go further. But a lot of people have had some element. Mm-hmm. As a physician, I have worked in hospital settings and in nursing home settings, mm-hmm. and in step-down units where I've actually been called as a psychiatrist, as consultation liaison on a large number of cases where in the hospital they came and required resuscitation, and then when they come out of that resuscitation, they start talking about their experiences while they were dead. And when they talk about popping out of their bodies and seeing grandma and going into tunnels, right. They get a psychiatric consult. Mm-hmm. That's me. Okay. So basically, the reason they get a psych consult is we want to rule out delirium, number one. Because mm-hmm. if they're delirious, that can be a very serious condition and needs to be treated. Mm-hmm. So that's what I have to do, is to see, are they delirious? And by being called in on so many of these cases, I had a chance to hear a whole lot of stories.
Right, right.
And it's been very interesting.
Right. Well, you know, you have the near-death experiences. there are the out-of-body experiences. What's the difference?
An out-of-body experience is just what it says, where a person's consciousness leaves their body, and that's really a part of the near-death experience. You can't really have a near-death experience while you're in your body. It's very rare. I can't think of any examples where somebody was in their body and had a near-death experience. They're not really dead then. I mean, in order to be really dead, you gotta come out of your body, and the experiences that occur separate from the body make up the near-death experience.
There are so many different types, it seems like, and people from all over the world, different cultures, have the same kind of experience.
There are more similarities than differences. The big elements in these experiences are very, very common. And, you know, I hear the same story over and over again, to the point where I was so fascinated when I first started working in a hospital setting or in a step-down setting. I was so fascinated by them. I used to record them. I stopped doing it because I got bored. You know, after a while, you get the idea that, man, everybody's got a story, you know, and it's like they talk a lot. And when people come out of these, they're so enthralled about them that you know, you don't get out of there after a half an hour, 45 minutes. They're telling you everything because it's a big deal for them. Who's going to listen to all that? And one thing that I realized very shortly as I started recording all this stuff, I thought maybe I'll get a book out of this. I got to thinking, you know, these books have been written. I'm saying if I had something novel to offer, I might be enticed to think about writing a book. I don't. The books have been written. All I can do is read the books that other people have written and say, you know what, they're right. That's what they're like, because you get the same story all the time. And as physicians, we see this. That's why most of these books are written by us, because we see a lot of people. And in psychiatry, people tell us things they don't tell other doctors. We see a lot of cases. And that's why, you know, I say I've seen hundreds of these cases. But, you know, after a while, I start asking. If you don't ask people questions about this, they're not going to tell you, because a lot of people are kind of embarrassed by this.
Do you see children?
Not too many. No, that's I do occasionally, but I don't see a lot of kids. I see predominantly adults.
It just seems like such a wide range of types of people that have the experiences of people who have sudden death, people terminally ill with long-term illnesses that have this experience, and then people that don't have any chronic or illnesses at all have these experiences. People of different religious backgrounds, as I mentioned, cultural backgrounds, different languages, all have this same thing in common. And to me, that is what makes it so mysterious, so to speak.
Well, they all have one thing in common. They're dead. I mean, their heart is stopped, and that's what they have in common. It doesn't matter how long it took to get there. Once that heart stops, and again, it doesn't, again, one-third of people, not everybody that experiences cardiopulmonary arrest will have a near-death experience. And my particular theory, and it's just a theory, my particular theory as to why that might be, is that the people that don't aren't sufficiently dead. And by that, what I mean is this: when somebody's heart stops, and they stop breathing, we don't immediately get a needle out and take a biopsy of their brain to see how dead their neurons are. Okay, we don't do neuron viability studies. Now, when you stop blood flow to the brain, what happens is after a time, that neuron will first of all use up all of the available glucose in the area, and it will stay alive. It'll live off of the oxygen and glucose that are in its immediate surroundings. Then, when levels drop to a critical level, it'll start eating itself. It'll start consuming itself, and that's when you get into necrosis, and that's when you get into irreversible brain damage. Now, somewhere along the line there comes a critical time when the battery is so low that the thing that we call the spirit or the soul, whatever you want to call it, that invisible thing that is the real us, is released. Okay? We are bound to our organic brains until the battery gets to a certain level. Now, we have no way of measuring that battery. Our technology isn't there yet. And so these people that have these experiences, they meet the criteria and they're popping out. The people that don't, they've still got enough juice left to where they're still stuck inside their bodies.
So that lack of O2 supply, could that just produce fear? And it's a different kind of experience, and not so much as an actual near death. And then also, if a person is actually dead, then how is it near death?
Okay, we define death historically, and you know, we define death as cardiac arrest, which cardiac arrest leads to cessation of breathing, and then you have brainwave cessation. Usually they all go together. So when your heart stops, you dead. Okay, that's death. Now, do you stay dead? That's another matter. Some people are revived after quite a while, actually. If you're in cold water, for example, we can pull you back after sometimes 15 minutes to half an hour. If you're cold enough so that your body hasn't started to eat itself yet. It's temperature dependent. Okay. Now there is that range. What we don't know is when does for you as a person, when will your neurons start to eat themselves? That's what we don't know. That's not what we're measuring. So the people that have the near-death experiences, again, this self that we can't measure, it seems to come out only when you are sufficiently dead. And who knows? We don't know when sufficient death takes place in order for this to happen. This is a model to try to explain observations.
Right. Well, there have been so many stories shared about NDE with so many people. How do you differentiate between the ones that are real and the ones that are made up?
Well,
because there's a lot of skepticism about that.
Very rarely in dealing with, I've interviewed, I would say, several hundred people who've had these near-death experiences. Out of the several hundred people, I can't think of one patient who had a classic near-death experience who was confused and thought who had a classic near-death experience that I thought was actually psychotic. Right? Because that's what we're talking about. Somebody is either really slow, somebody who had an illusion. An illusion meaning they had a dream and they thought it was real. Now sometimes with advanced Alzheimer's, that can happen, where they have a dream and they confuse their dreams with reality. That does occur. But these dreams that they're having don't present you with the classic characteristics of the near-death experience. I've not come across a case where somebody dreamed that they popped out of their body and they might see their dead relatives, but as far as popping out of their bodies, looking down at themselves on the bed, going into the tunnel, talking to God, getting a life review, these are the elements of the near-death experience that aren't present in people's dreams as far as, now somebody might have that somewhere. I've not seen that, and I don't think that's very common. Now, are there people that want attention, that would make up something like a near-death? I think there might be. I've not seen anybody with a personality that messed up. And it's possible. There are people who really love attention who might do something like that. But when you start talking about that, having a near-death experience means you're kind of weird. And a lot of people who are worried about shame don't want to come off as weird. And so that's another reason. Why would somebody make up a story like this? Because you do come off as a little weird for having had something like this. And there are people who are going to look at you sideways and say, really? Right, sure you did. And people don't like that.
How is it possible that the brain can remember in an unconscious state what it experienced in a conscious state? So when a person goes into cardiac arrest and they're in an unconscious state, of course, how does the brain remember what happened?
You're presuming that it's the brain that's holding the engram, that you're presuming it's the brain that is actually recording the events. It clearly isn't in several cases. In one of the slides that I brought with me, there's a clip of a woman by the name of Pam Reynolds. She, for example, they were repairing an aneurysm and had to stop blood flow to her brain and cool it down. She was hooked up to an electroencephalography, electroencephalography, so there was absolutely no brain activity whatsoever. And if you hear, even if you just hear something, evoked potentials are produced, and you can see the hearing that the brain takes place. It was flat. There was virtually no electricity in the brain. The brain experienced zero, and yet she fully described the operating room arena. She described conversations that the doctors were having. She described the tools that were used on her surgery very clearly. Right? Now, her brain didn't record any of that. So it was the other self.